Do you leave chest tube after lung resections? Hi, I'm Cecilia Quijena from Cincinnati Children's Hospital, and I think this is an article that you should know about. This is a retrospective review done in Seattle from 2013 to 2022, and their aim was to clarify the utility of the chest tube after lung resections. And what did they find? They had 130 procedures, 59 lobectomies that were group 1, 19 diagnostic wedges that were group 2, and group 3 that were 52 excisional wedges. Within group 1, 74.6% didn't have a nerve leak. In group 2, 89.5% didn't have a nerve leak, and in group 3, 80.3% didn't have a nerve leak. So it seems that most of the patients didn't have a nerve leak, regardless the procedure they had. So maybe most of the patients may not need a chest tube after all. Let us know what you think and stay tuned for more articles that you should know about.